Hi, my name is Trent Taylor, the Vice President of Software Development here at Micro4. And today I want to clear up as much confusion as possible about ARRA and meaningful use. More importantly, I want to show you how PracticeStudio can make short and easy work of this very frustrating and time-consuming task. So where do you start? Have you heard so many acronyms and phrases like ARRA, ONC, ATCB, and meaningful use that you just don't know where to even begin? If you try to meet all of these requirements manually, it'd be extremely difficult and nearly impossible. Many EHR systems don't give you all of the necessary tools you really need to see your real-time progress and where you are in the meaningful use process. Frustrating, right? We know how valuable your time is, and adding dozens of tedious steps to your daily routine just doesn't make sense. This is where we come in. This is what we do. It is our job to make all of this monotony seamless so that you can focus on what is important, your patients. We have spent a phenomenal amount of time creating real-time solutions that make this entire process part of your natural routine and extremely easy to use. On that note, let's talk about what each of these elements are and what they mean to you. What is ARRA? ARRA stands for the American Recovery and Reinvestment Act. It was a nearly $800 billion stimulus act that was signed into law by the President on February 17, 2009. The portion of the Stimulus Act that pertains to providers is called HITECH, which is allocated for reimbursement to you, the provider, for using a certified EHR or electronic record health system. So in short, this is the bill that was passed that provided funds for you to receive reimbursement checks to help pay for your EHR system. What is OCCATCB? An OCCATCB is an Office of the National Coordinating, Authorizing, Testing, and Certification Body. It's a mouthful, right? This is also a government-sanctioned body that is authorized to certify EHRs. For any EHR to become certified, they must go through an OCCATCB. We elected to use Drummond for the certification process of PracticeStudio. So all of this leads to meaningful use. Meaningful use is ultimately all of the guidelines that must be met by the provider to prove that a certified EHR system is being used according to the governmental guidelines. Meaningful use must be proven in order to receive the government reimbursement. Reimbursement is based on Medicare or Medicaid billing. Only one of the programs can be chosen. However, proving meaningful use is based on the entire patient population, not just those on Medicare or Medicaid. We'll talk more about that and meaningful use and how to accomplish this through PracticeStudio in a moment. But first, a common question that comes up is whether or not ARRA is mandatory. The short answer is no. So how do I get my money? Well, there are 5 basic steps to follow. Step 1, make sure that you are eligible for the Medicare Incentive Program. This can be done online through the CMS website. Eligible professionals under the Medicare EHR program include doctors of medicine or osteopath, as well as chiropractors. So visit the website on your screen to get the ball rolling if you haven't done so already. Step 2, register with the government. There are step-by-step registration instructions available on the CMS website. You will be asked some simple questions, one of which is whether you currently have a certified EHR. You can register for the program prior to purchasing your EHR system, but later you will be required to provide an EHR certification number when you attest for payment. Step 3, adopt or purchase a certified EHR system. Let me suggest one to you, PracticeStudio. One thing to be wary of is the term certified. A number of vendors say that they are certified, but this many times means that they are only certified on certain elements or pieces. For example, one of the most simple elements of the extremely vast certification process is whether you can collect and save basic patient demographic information, such as the first and last name. This does not make the EHR a truly certified system. So you want to make sure that you choose a complete EHR certified product. PracticeStudio is just that. PracticeStudio is OCCATCB ARRA certified as ambulatory complete EHR. This means that we are a one-stop shop and require no third-party software or manual processes to meet your meaningful use. Step 4, achieve meaningful use. You must be able to demonstrate meaningful use of your EHR for a consecutive 90-day period in your first year of participation and for a full year each subsequent year. While we're on the topic, if you don't get in under the October 1st, 2011 deadline, don't worry. You can start in 2012 and still receive the full reimbursement. To meet meaningful use, you must meet all 15 of the core objectives and 5 of the 10 menu set objectives for a total of 20 overall. Sounds kind of scary, huh? With PracticeStudio, it's not. We already have all of the defaults and most common setup options upon install, but still give you the flexibility and options to choose whichever you like if other objectives better meet your clinic's needs. Also, by just installing PracticeStudio, a number of the core objectives are immediately met, such as drug-drug and drug-allergy interactions, as well as drug formularies. Step 5, attest for payment. Attest means to certify or declare, and it basically means that you have to legally state on the CMS website that you have met all of the meaningful use criteria. Now, if you've ever had to fill out government paperwork, I'm sure that you know that it's not very much, well, let's just say fun. PracticeStudio makes this process a breeze. PracticeStudio has a meaningful use attestation report that matches the CMS attestation wizard, making the paperwork portion of getting your money a snap. Before we finish up, let me show you a few ways that PracticeStudio will help you accomplish all of these tasks. PracticeStudio is designed around the provider's workflow, allowing real-time views of all of the required data necessary for capture. So while the provider is seeing the patient as part of the real-time encounter, the dashboard shows all of the necessary components based off of the provider's objective selections, what has been completed and what still remains. Not only that, all the provider has to do is click the objective that has not yet been met, and the necessary screen or dialogue for completing it will appear. Simple. That is the patient level, but how do you know where the provider is in achieving meaningful use for all patients for the period? The Provider Real-Time Dashboard. The Provider Dashboard shows exactly where each objective is in regards to meeting meaningful use. There are also graphs available for many of the objectives, making it easy to see where meaningful use was for each objective over time. All the detail can also be printed out if necessary. Finally, as mentioned earlier, the Meaningful Use Attestation Report lines out the information for attesting to your meaningful use and completing the online process. If you want to learn even more, talk with one of our sales representatives about an online demonstration. If you're a current user, then be sure to check out the tutorial section of the My Account area to get specific, step-by-step instructions on how to use all of these tools and what we have discussed, and much more. Thank you for considering PracticeStudio for your EHR needs, and have a great day.